Well, good afternoon and welcome to Cut to the Chase with Senator Chase. This is our weekly call-in town hall and radio show. And this is a call-in town hall with your state representative, so feel free to call in. The number here is 804-454-1366, 804-454-1366. You can ask your question right here, right now. Take advantage of it. I'm State Senator Amanda Chase. I'm your weekly radio show host. I serve you at the state level. And my office is actually at the state capitol in downtown Richmond. And I represent the 11th Senatorial District, which includes all of Amelia, all of Colonial Heights, and most of Chesterfield. In fact, I was in Colonial Heights today at a Colonial Heights Chamber event. They had a great women's event there. So I have also co-founded the Transparency Caucus, which I talk a lot about on this show. It's kind of a theme of why I ran for office. I think our legislators need to be more transparent, so that the people, we're accountable to you. We work for you. And so I think it's important that you know what we're doing in work sessions. And those work sessions are done in those committee meetings. And so for the first time in Virginia's history, you can actually go to virginiageneralassembly.gov and you can watch us in action. And in action we are going to be, because we are still in a reconvened special session. And we're actually going to go back to the General Assembly in Richmond on Monday, May the 14th. Now, I will tell you that I anticipate that will not be a very, very productive session. It's kind of there are many formalities that take place in the Senate, and we'll probably end up just taking the House budget and forwarding that on to the Finance Committee. So you probably won't see a whole lot come out of that. But listen, we have got to pass this budget. And I think it's imperative that we do. And the challenge that we have right now, the governor sent down his budget to the House this go around. And let me just start by saying, all the information that I gave you about session and regular session, that's over. Okay, so that is done, gone. The Senate no longer has an official budget that's before the General Assembly right now. We are looking at a completely different session. This is a special session. So what happens in a special session is we get the governor's budget. The governor's budget gets sent down to the House, and then the House is going to send it over to us, and that's going to happen on that Monday, May the 14th. So just so that you follow where we're going here, let me just tell you right off the bat, I don't support the House budget, and I don't support it for a number of reasons. One of those being is that it has Medicaid expansion in it, and that's a problem. It also has a hospital tax in it, which that's a problem. I don't think we want higher taxes because we know those hospitals are going to pass that tax on to us. And we've talked on the show about the number of reasons why we don't want to expand Medicaid. So that's a problem. But, one of the things that really concerns me is that the main purpose of Medicaid is to be a safety net for people that cannot work, that can't afford it. That was the original intention of Medicaid, and it's expanded to something then more than what it should be. And, we're already at about 25% of our state budget goes to Medicaid. At one point, it was only 2%, and now it has grown, and that's without even expanding Medicaid. We look at the numbers. I've looked at what other states have done that have expanded Medicaid. And let me tell you some of those findings. One of the things that we're seeing, we've talked a lot on the show about the opioid and heroin crisis that we have, and how everyone, their lives are touched by someone they know that has been affected by the opioid crisis. In the states that have expanded Medicaid, there's an increase in the number of opioid heroin crisis. There's deaths. It's a problem. The abuse skyrockets because you have more people, I guess, seeing the doctors, and therefore they're prescribing these opioids and heroines. I'll get this right. Sometimes we get tongue-tied on the radio, but they're prescribing more opioids. They're not prescribing the heroin. Let me be straight about that. But what happens is people who get these through their doctors, they get these prescriptions, and then the doctor says, I know you have this pain, and you're suffering because of all this, and they're giving you the medication that you need, just enough what you need. But at some point, they don't want you to get addicted, so they try to wean you off of that. And some people, they still have the pain, and they just, for whatever reason, they can't afford it, and they're turning to the heroin because it apparently is pretty inexpensive. So that's a challenge too. So the differences between the proposed spending plans that the House and the Senate have, we're still looking at a chasm of about $3 billion. That's what we're looking at, the differences between the budgets. And that's why it kind of concerns me that we're not going into session until May the 14th. We have so much to work out because remember, everything goes into effect on July 1. We've got to have a budget, and we need one now so that we can start reviewing. So we have talked a lot about the minority of House Republicans that join with every House Democrat to approve a budget that was fully implementing Obamacare in Virginia. And while every Republican senator, along with 4 Democrat senators, they voted to approve a budget based on existing revenues without expanding Medicaid. I really wish that they would use that Senate budget that we had passed, minus the any funding in there that might be in there for Planned Parenthood. We need to take that out. That's just recently come to my attention with Victoria Cobb with the Family Foundation. That needs to come out. But the Senate budget was a clean budget that did not have Medicaid in it and did not have the hospital taxes in it. And so I'm very concerned about the direction that we're going. And I will tell you straight up that I will not vote for a budget that has a slush fund for Planned Parenthood or Medicaid expansion in it or the hospital tax. So we've got a lot to work through. And if the policy were to be enacted, it would not only increase the benefits for any of the 1.3 million Virginians currently covered by Medicaid. Medicaid currently reimburses the hospitals, the healthcare providers, the physicians who accept Medicaid patients for a portion of the expense of providing care to around 650,000 children. And these are the low-income families. But it also takes care of about 360,000 people who are the caregivers or the parents of those children and pregnant women. It's important that we stick to what Medicaid was designed for. I've talked a lot about the Priority 1 waivers and that there are 3,000, there's only 3,000 people on this. And whenever the House expanded their budget and they included Medicaid expansion and they included the taxes and all that spending that they did not even address but about 800 of the 3,000 Priority 1 waivers. And so that is really concerning to me. And not only that, but most of the money is not being spent on health care. And I know, I just want to say that again so you catch that. Not only did they take the 9-to-1, meaning the federal government pays $9 for every $1 the state takes in, but the money is not even going to be spent on health care, which I have a problem with that. So anyway, so a lot of people are saying, why can't Virginia just come up with this 10%? The federal government's going to give us $9 for every $1. So would that not be a crazy thing not to take up? Well, Virginia has to identify over $300 million to cover its portion of fully implementing Obamacare by expanding Medicaid. And the House's proposal, as I mentioned, does that with the new tax on the hospitals. But that tax will not likely cover the growth of that expense. Remember, we were talking about the rising cost of health care and that expense. And it's going to average nearly 9% annually over, they said it's averaging 9% over the last decade. So I still stand by Virginia should not expand Medicaid. So when we come back from the break, I just want to let you know that we have a special guest coming on today, and his name is Congressman Dave Brat. And we've had him on the show quite a bit, and we have a lot of things. We're going to get an update from him. As you know, he is the U.S. Congressman of the 7th Congressional District, and he serves on the House Budget Committee, Education and the Workforce Committee, Small Business Committee, and he's also the chairman of the Small Business Subcommittee on Economic Growth, Tax, and capital access. And I love that he's a member of the Freedom Caucus. All right. Is Dave there? Dave, are you there?
Yeah, you bet. Hey.
Hey, thanks so much for coming on the show. We've got 1 minute to the break, but
Good.
But we're really looking forward to having you come on. I can't wait for you to tell the folks about the health savings account, HR 247. And
okay, good.
So we're going to be back with Congressman Brat. We have him on the line here. He is just fresh in from the swamp. And so stay tuned. We'll be right back with Cut to the Chase with Senator Chase and Congressman Dave Brat. Stay tuned. We'll be right back. Welcome back to Cut to the Chase with State Senator Amanda Chase and my very special guest today, Congressman Dave Brat. Dave, welcome back.
Hey, great to be on, Senator. Thanks for having me.
Well, we're excited to have you back. And Dave just in from the swamp, literally just pulled in the driveway here. And thanks so much for coming on the show today. We cannot wait to hear about HR 247. Tell us all about it. How are we going to save money, Dave?
Yeah, well, I put this bill in, and it's kind of coming back now because the Obamacare crisis is upon us, right? And so the promise was you can keep your doctor, you can keep your insurance, and prices would go down, and the prices are going through the roof. So right now people are looking for other solutions, and so the HSA solution, my bill increases the amount you can put in your HSA from $3,400 to $9,000. And $18,000 for a family. And the importance of that can't be overstated. I had help with that from the Cato, Michael Cannon, and several other economists up in D.C. And the most important part is that people can put money into their pre-tax dollars, right? So right now, if you have employer-provided health care, you're getting that. But if you're self-employed, if you're on your own, or if you work for wages, or you work for an employer that doesn't have health care, you're out of luck. And so that's a remnant of, post-World War II logic, and it doesn't fit the modern economy. And so that puts everybody on the same footing and allows everybody to get health care with their pre-tax, right? Instead of after-tax dollars, you pay your federal, state, local sales tax. People are paying 40 cents on the dollar. This puts you back to dollar for dollar. So and then that's your own money. And so that's the second most important part probably is you're shopping now with your own money instead of, paying a copay and then not even looking what hospital costs, what drug costs, what's the doctor procedure cost. No one shops that stuff because you're subject to your insurance company. And so there's just a lot of great properties to it. And the left gets upset and they say, well, that, if there's not a guaranteed safety net to it, but you can have that. HSA, you can still have a safety net and pre-existing conditions and all that stuff, and you can have a social debate. Instead of Obamacare, how many dollars do we want to put in everybody's HSA? And so it's by far the most efficient, right? Milton Friedman and the free market folks know that it works, and this logic applies to every other product in the world, except for 20% of our economy, which is healthcare costs. And so we want to get our healthcare system back in our own hands so that you're free to pursue what's best for you, right? Buy the insurance product that's best for you, and then you can use the dollars in your HSAs for everything. You can use them to pay your health insurance premiums. You can use them to buy prescription drugs, other non-prescription drugs, healthcare needs that you have. You can use it to pay your copays, your deductibles, everything.
That's great.
And that's missing right now. So that's why we're pretty excited about it. But it's going to be tough, right? The swamp is run by lawyers and lobbyists and special interests who have guaranteed coverage and guaranteed profits due to being part of the elite. And so it's hard to break through on behalf of the American people, but I ran on that, right? I ran against the swamp and against all these elite special powers up in D.C. for the people, just like you did.
That's exactly right. Now, I'm going to switch subjects on you. Let's go directly and talk about the tax cuts and how we're switching over to the end of the old tax code, and which was outdated and confusing.
Yeah. No, I mean, exactly. And so one thing I didn't anticipate right now is small business. I'm getting a lot of positive feedback because people are doing their quarterly prepaid taxes, right?
Mm-hmm.
And so you don't have to wait till the end of the year to see the benefit they're getting. And so I've got small businesses that are saying, wow, I can't believe the smaller amount I have to pay in my quarterly estimates. And so they're seeing the real world return right now. So small businesses are buying that extra pickup truck, hiring that extra person. And, a lot of these scores, right, the left is saying, well, the tax cuts weren't polling that great prior. But right now, you go talk to any small business person and you see and ask them, right, tell the news folks, get the small business people in front of the TV camera and ask them, right, there's your poll. And you'll hear just overwhelming positive news coming out. Altria gave $3,000 bonuses to everybody. Wages are going up 3%. GDP is growing 3.3% this year, according to CBO. And if you grow at 3, guess what? You pay for the tax cut. So the left was just joyful paying attention to deficits for the first time about 6 months ago because they cost $150 billion a year. But if you grow at 3%, they're paid for. And then what the media won't tell you and what the left won't tell you is at the end of the year, it was the Democrats. In order to get a budget passed, we had to increase spending by $400 billion to get 9 Senate Democrats on board. And so now you don't hear them talking about debt and deficits anymore because they can't sustain the argument for too long.
Well, I love how the Tax Policy Center said over 90% of middle-class Americans are getting a tax cut this year to the tune of $2,000 for a median family. I mean, that's the Tax Policy Center. So,
right, no, that's it. And the average family in our district makes about $70,000. They're going to get $2,200 back, and that's not crumbs. That's a real deal.
Let's jump real quick to you joined Representative Ann Wagner from Missouri to vote for a bill to give states tools to fight online sex trafficking. Tell us a little bit about that.
Yeah, well, thank you for all your work on these issues, right? All of these things are linked. The sex trafficking, people may not know. I mean, it's prevalent along the 95 corridor in the poverty sectors, but also stretching up into Short Pump. And the police and sheriffs will tell you, I don't even like talking about it on the radio or on TV because it's so revolting. And so this is going to give dignity back to women. And there's huge progress instantly after that bill passed. And it was, bipartisan, right? No one ever says the news on that, working together across the aisle. Bipartisan, huge success. And this web page out there called Backpage, where all the trafficking and these horrific acts take place, is shut down immediately that week. And so the bill has had an immediate effect, and we're hoping for more than that. And then it bumps into the opioid issue and some of the drug stuff. And we have our heroes in our district there, right? Sheriff Wade and Carl Leonard in Chesterfield have been doing recovery programs in the prisons, in the jails for years without any money. And so we passed an opioid bill, too, that is complementary and that actually does recovery. And, we've got other programs in our area that are awarded with the Virginia Recovery Foundation in Richmond with Mike Zohab is doing outstanding work. New Life for Youth, a lot of the spiritual-based religious centers never get recognition. I'd like, recognize them. They run a group called Mercy Moms that take care of moms and their children that are just in terrible shape due to this opioid epidemic. And so we've got great folks around our district doing great work. You're working on it all year. I'm working on it up on the federal. And it's just good to report some good news that's taking place.
Absolutely. And, it's what's so amazing to me, and I've even had my friends who are doctors to come to me and say that the culture is changing. It used to be that one of the top things a doctor would ask you is what kind of pain are you in, and they would treat the pain with the opioids, not knowing. They were told these are not addictive. And they were prescribing them, and they feel responsible. They feel bad, about what's happening. And that's why we see, when we were in the jails, I was with the governor a couple of weeks ago, in Sheriff Carl Leonard's Chesterfield jail, and the governor actually asked for a show of hands of how many people that were sitting in that room started off with a prescription drug, and I would say all but 3 people, and there were probably like 60 people, and they raised their hands.
Yep.
It's very
exactly right.
eye-opening.
Yep. Yeah, and that's right. And so the one tip we can share with people listening is when you're done with that pain medication, and they overprescribe, right? They give you a bottle for way more pills than you get rid of that bottle.
That's right.
Throw it out. Don't have. We have break-ins now. People aren't going for the plasma TV anymore. They're going to the drug cabinet to get a hold of these drugs. They're so powerful, and when people are addicted, unfortunately, that's
Congressman Brat, we're going to a break. Do you want to stick around, or do you have to go?
I better go. I'm just with my daughter in town, back from the swamp. I'm gonna spend a little quality.
Welcome back to Cut to the Chase with State Senator Amanda Chase. This is our weekly call-in town hall and radio show, and I welcome your calls. The number here is 804-454-1366, 804-454-1366. And I certainly appreciate Congressman Dave Brat coming on today to give us a brief update about, it's been a couple of weeks since he's been on, and nice to get the update from him. And it was his daughter's birthday. So happy birthday, Sophia. And they're gonna go get a puppy. So good luck. Y'all have fun with that. I just wanted to talk to you a little bit about a couple things that have come up in my office this week. We're getting a lot of activity and calls and emails about the economic development authorities. And, I am active on Facebook. I know a lot of people are surprised at that, but I really do try to stay connected with you all so that I can represent you, right? And so why not take advantage of technology? And I know that we have had Mike Uzel, who heads up BAIRD, which is a citizen activist group in the Bermuda District, in order to take on this concern with the Matoaka Megasite, which is in the Bermuda District. And I typically, I typically support small business, and I have worked with several of our supervisors this week. I've actually met with them to try to start those conversations about that. We've also talked about some other things about which has been in the news, the body cams and everything, so we can work together on some of these issues. I did make a statement on Facebook, which now I'm getting Channel 12 and others who are reaching out to me as my phone is blowing up right now about my statement on economic development authorities in general. And, here's what I would tell you. I am 150% towards making sure that people who are in charge of taxpayer money are elected by the people. I'm just so in favor of that. And, anytime that we create an authority or a board or anything like that, as a legislator, one of the things, and as a citizen legislator, one of the things that I always look at is where is the money being held accountable? Who is tracking that money? Who's spending that money? And for it to be consistent with the Constitution of Virginia, my interpretation is that taxpayer money needs to be spent by those who are elected representatives. And, there are hundreds and thousands of these economic development authorities that are across the state. And they were created actually by the General Assembly in 1968. And bipartisan support, Republicans and Democrats looked at it as a way to bring economic development to their communities. And, sounds like a good thing. What we're finding in some situations is that, and I'm going to speak specifically to the Matoaka Megasite, based on the information I have in front of me now, I would tell you that there are about 40,000 residents who are not real happy that when they bought their homes, that if they did their due diligence and they looked at the comprehensive plan for Chesterfield County, and they saw, where the zoning was, they bought their home with certain assumptions, And now they're talking about changing that and bringing in some type of industrial site. I understand their concern, and I understand that thoroughly. I was actually in a similar situation, and that kind of propelled me to get involved with politics. I had a similar situation where they were trying to cut a main thoroughfare through my quiet little neighborhood. And so, it's so important that the Board of Supervisors keeps these economic development authorities under their thumb. And so when I introduced some legislation this session, it simply said that an economic development authority's budget must be approved by the Board of Supervisors because they are elected by you. And if you don't like the way they're spending your money, then you can vote them out of office. So that was my bill. And I personally feel like we need to stick to the core functions of government. The economic development authorities, by state law, have the ability to develop land. They're given that ability to do that by state law. That gives me a little heartburn, I have to be honest with you, because I feel like that's competition with the private sector and our private developers. And so if you're a free market, limited government type of person, which I am, then I think that you have to be very careful with these economic development authorities. And so I made this statement on a Facebook post, and I said economic development authorities are unelected. That is true. Okay, that's what I just said. So economic development authorities are unelected. They are not elected and held accountable by the people they represent. I stand with the thousands of homeowners who brought their properties under the current residential zoning, under the current comprehensive plan, and oppose this Matoaka Megasite, which should be, for transparency's sake, called the Bermuda Megasite. And that's really my big holdup right now, is that whenever this program was started, whenever they were applying for these permits, and I understand the marketing and that type of thing behind choosing Bermuda, but it looks like it's not transparent to the people, and that creates a sense of distrust with the 40,000 residents that are in that area. So when we come back from the break, I want to hear from you. I've also invited the Board of Supervisors, Dr. Casey, at some point. I'm asking them to come on as well. Welcome them to come on. In fact, they can call in tonight if they would like to. So we'll be right back after the break. Stay tuned. Welcome back to Cut to the Chase with State Senator Amanda Chase at your service here. Give us a call, 804-454-1366, 804-454-1366. And, we're talking about a little bit about the Matoaka Megasite because it's just been a hot topic that I've spent a lot of time on this week, meeting with a number of stakeholders. And lo and behold, Speaker Cox has also come out with a statement. And he says, while I believe industrial site development in general is merited, it is clear the Chesterfield location does not have the community support necessary for such a significant project to succeed. I hear from constituents regularly who have not been satisfied with the handling of this project and do not approve of building a mega site in Chesterfield. So I thank you, Speaker Cox, for joining me in opposition to this Matoaka Megasite in its current form. I just think it's disingenuous and not that the people were bad that came up with this, but I'm just telling you, because I've worked with in grassroots politics for 12 years now, and people already don't trust politicians. And so we don't want to give them a reason not to trust us. And so it's so important that if we're going to have an industrial site in the Bermuda District, I just feel like you should call it something else, the Bermuda Megasite. I think it got off to a bad start because it was called the Matoaka Megasite. And then your trust is already broken. So everything else you say after that point, nobody's listening to, especially after Meadowdale, after Tranlin, and some of these other projects that have kind of blown up. People are a little bit leery of spending taxpayer to prepare a site that may or may not come to be. So that's kind of late breaking news. And, I've always told the Board of Supervisors that as I get new information, and I know they're doing studies and analysis and they're working with other people, let's work together with the community and see what they want. I mean, I work for the 40,000 people that live in those homes. And so I work for you, and Speaker Cox works for you, and we hear you loud and clear. And we're putting your needs first. So I think it's good. I do want to say that I do agree with our Board of Supervisors that in Chesterfield we do need to diversify our tax base. Most of our tax base comes from you, the taxpayer, from residences, not business, as in some other counties. So I definitely appreciate what the Board of Supervisors is doing, and that is to try to diversify our tax base so that it's not so dependent on you, the residents, as we're kind of known as a bedroom community. And so, I do applaud their efforts in trying to, get some more business here. And there's some more discussion. I think we need to learn from this. The way that this was rolled out was a mistake, honestly. But we do need to have that open dialogue with our constituents and get their input and go from there. So that's all I'm going to say about that. But you all are welcome to call in 804-454-1366. And that's the Matoaka Megasite for you right there. I want to talk a little bit about something else that came up today. So the question is this: do you feel that legislators should be able to fundraise in a reconvened session? So 804-454-1366 is the number, 804-454-1366. A lot of people don't realize that state legislators make even less than our school teachers, probably about half of what our school teachers make. It's supposed to be a part-time legislator position, but with social media and those types of things, if you're being responsive to your constituents, I will tell you it is a full-time job. It really is. If you're going to be attentive and go to the meetings and be in your community and respond and be accessible. But what's happened over the years is legislators will not vote themselves a raise. They're just not going to do it. It's not the politically correct thing to do. In fact, I think it's been decades. I think it was the 80s, the last time that the legislature ever even had a raise. Our base salary is like $18,000 in the Senate, just to give you an idea. And we get a very limited budget for our staff. It's about $5,500 a month. And our constituency is about 250,000 people. So if you think about 250,000 people reaching out to their state senators, will you have the resources needed to get your question answered? And we try to streamline. I mean, we do a lot with very little. But my whole point is this. A lot of people don't realize that even whenever you're not running for office, that you're still having to raise funds to pay for operational expenses to supplement what the state does not pay. A lot of people don't realize that. Can you imagine taking a job for wherever you work and then you have to raise funds to stay in that position, and then you're raising, let's say, if you make $18,000 a year and you're having to pay $10,000 in operational costs a year, plus your regular, some of your regular operational costs. So anyway, it's all very interesting. But so what happened with the big question was, and I know that Governor Gillespie had advocated for saying that if we had to come back into a reconvened session, which doesn't normally happen. I mean, normally we passed a budget. The last 2 years that I've been in session, whenever we left, we were done officially with our official duties, and our budget was passed when we left in March or April. But this year is different, and so our regular session is over, and now we're concentrating on the budget, and so we have to come up with a budget. And by law, we can still fundraise, and like I said, we have to pay for our operational expenses. Our bills still come in whether we're in reconvene or what have you. And so and the state doesn't always pay 100% of all that. So taking that into consideration, I know that I had a fundraiser that was scheduled that was in May, and I chose, not because I legally had to, but I just felt that it was something that I should do. I always try to be above reproach, and I just decided I would reschedule my fundraiser because, number one, I had to focus on the budget, but it's not mandatory, and I know that there's different philosophies out there, and I want to get your take on it. If we go back into a reconvened session, do you think that your legislator should be allowed to fundraise? Let me know what you think. 804-454-1366, 804-454-1366. So there you have it. Let's talk a little bit about Senate Bill 264 was a bill that I co-patroned that had to deal with a Campaign Finance Disclosure Act of 2006. And that is a bill that I co-patroned that passed the Senate and the House and is waiting on the governor's signature. And it has to do with campaign finance disclosures. I have that at the state level, but our local and constitutional officers don't have that. So to create greater transparency, and so you, the people, can see their campaign finance reports, I just thought that was a good thing to do. So I signed on to that bill. Let's talk a little bit about Senate Bill 715. This is a bill that I introduced that allows our EMS and our firefighters to utilize their concealed carry permit rights with the permission of their chief or county, if applicable. And it's similar. It would have been similar training to that of a fire marshal. The bill passed the Senate but was defeated in the House. And basically, under current law, there is nothing that prohibits our firefighters and our EMS from carrying, honestly. But where they cannot carry is in state buildings, can't carry there, and then, where it's forbidden, and then also our schools, where our kids are. So let's just say you're a firefighter, and, I know this is especially happening in in the more rural regions, where they're having to serve as fire and EMS, and there's more limited resources. So you have a lot of duplication of duties and responsibilities. And, in talking to some of my fire chiefs and EMS chiefs, they have said that there have been situations where they felt very vulnerable in some situations where there was an active shooter and there was no police around. And so they wanted the opportunity to be able to defend themselves should their life be put in jeopardy. So I introduced this bill at the request of some of our grassroots firefighters and EMS, and I am going to reintroduce that next year. And, what do you think? Do you think that our firefighters and our EMS should be able to protect themselves? I want to make sure that people who are volunteering to look out for us in our time of need are willing to serve. And if we look at the media, they have become targets, unfortunately, in some cases. Well, we're going to go to a break, but we will be right back with Cut to the Chase with Senator Chase. Stay tuned. We'll be right back. Well, it's already time for the final segment of Cut to the Chase with Senator Chase, our weekly call-in town hall and radio show. And I am going to just give a quick recap. We really, unfortunately, only got 3 minutes, so I don't really have time for any more calls. But I do want to give a brief recap. For those of you who are interested, next Friday, May the 4th, Congressman Dave Brat has a breakfast. It's from 8 to 10 a.m. It is a fundraiser, and it's at the Richmond Marriott. And for more details, you can go to davebrat.com. That's davebrat.com. And I'll be there, and Scott Lee is going to be our MC. And so that'll be a good time, and I hope you can come. So we talked a little bit about what's going on in the swamp today, and I love the idea of having these HSAs that basically the accounts that allow people to save money tax-free so they can help pay for some of their own medical costs. The HSAs that Dave's talking about, they're creating an incentive to pay attention to prices, which, if you're spending somebody else's money, you're not really paying attention to prices, are you? So it adds a small degree of market discipline to an industry that's really, really pretty expensive. And among other things, most of the payments are made with what feels like, as we said, is other people's money. We talked about how Congressman Brat's bill would expand the amount individuals can contribute annually to an HSA. He would increase it. The current amount is $3,450 to $9,000. And then limits for a family are going to rise it's going to more than double to $18,000. And those contributions are directly going to reduce the income on the federal tax returns and can also grow without being taxed. It would also restore the patient's ability to use HSA funds for non-prescription medications, which is an option, if you remember, that the Affordable Care Act took away. But what's really revolutionary about Brat's proposal is its provision that for the first time, it authorizes HSA savings to be spent on premiums for health insurance and not just for the high deductible policies, which is right now, that's currently the case. I almost think that's a tax. If you're paying into a high deductible policy, you're paying those monthly premiums, and you're really not getting that. Those the benefit on the front end to be proactive. So anyway, this is going to go a long way towards correcting the almost incalculable financial and medical dysfunction over the past 7 decades. This is the discriminatory tax treatment of individuals versus employer-provided health plans. And the coverage established by employers is not taxed. But the insurance purchased in the private market must, for the most part, be paid for with after-tax dollars. So I think it's a step in the right direction. And I think that's why we sent an economist to the swamp that would understand these free market principles. So that's very important. So I hope you'll support Congressman Brat. And, it's also interesting. The last thing I'm going to talk about that I haven't spoken about today is Virginia Governor Northam's veto of the bill that was banning sanctuary cities. We passed the bill that in the House and the Senate that would basically ban these sanctuary cities. And sanctuary cities it's a safe haven for people who don't follow the law. I don't think any type of government, local or otherwise, should be embracing sanctuary cities. And that's simply what they are. And they've been turned into something that is completely different. So it's already come to an end here. Thanks so much for tuning in to Cut to the Chase with Senator Chase. We will be back next Friday, same time, same place, 6 to 7 p.m. next Friday. Hope you would join us for Cut to the Chase with Senator Chase. Thank you. Have a great week.